Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about who is a public health dentist and what do they do. Let's start. So this episode is very close to my heart as I'll be talking about a public health dentist who is basically, wired to create awareness amongst the masses. Actually, I am also doing that as a periodontist through YouTube and through the love of my audience. So a public health dentist is trained for 3 years in terms of when it comes to the diagnosis, the indices, that means the way you can quantify a disease, and to talk about the surveys, the treatment planning, the policy making, and the trials that are used for treating various oral diseases. Now their work is not just limited to private clinics because of the fact that they are very profoundly spread out during to the whole country, because of the fact that they want to reach the most remote areas of the country in order to spread the awareness about oral health, the awareness about cancer prevention, the awareness about the deleterious habits of tobacco consumption and other things which can cause cancer. And also they want to do the survey, the treatment planning, and they also help in they're forming the backbone of policy making on a very national level when it comes to oral health diseases, prevention, intervention, and management. That's very important. These people are trained for 3 years in terms of how to diagnose diseases, how to treat them, how to prevent them, what policies can be made, what schemes can be made, what surveys can be made, what treatment planning can be done, what policy planning can be done, what jurisdictions you have to basically follow, and all those things. So the job is relatively very administrative in its own core, and it is very interesting once you get the hang of it. So that's it for today. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly please refrain from calling me directly as I might be busy with patients. Just drop me a WhatsApp message and I will get back to you within a couple of days. If you have any queries, doubts, apprehensions, or suggestions, kindly please feel free to put them in the YouTube comment section. So that's it for today. Thank you.